So the next issue that we're going to talk about is brain tumors in children, something that I deal with quite often with the neurosurgeon that I work with. Pediatric brain tumors are the most common solid tumors in children, unfortunately. So it's quite sad, but if a child is going to have a solid tumor, solid organ tumor, it's likely to be in the brain, unfortunately. And these include medulloblastomas, astrocytomas, craniopharyngiomas, ependymomas, and based on what type of tumor it is, what type of tissue it is, it will dictate the severity, the prognosis, the aggressiveness of the tumor, whether surgical treatment alone is adequate, whether they will need chemo and radiation. And that will be managed in conjunction with the neurosurgeon, the pediatrician, and the pediatric oncologist. Remember, posterior fossa tumors are an important issue in children, and it's something that we're going to discuss in detail during the tutorial today. And especially medulloblastomas in the posterior fossa, but posterior fossa tumors can account for over half of all pediatric brain tumors. And the resection of these tumors can be incredibly complex. And I will tell the story just briefly of a patient that I anesthetized for posterior fossa surgery, whereby we had to do two 12-hour debulking surgical procedures with two 12-hour anesthetics to try and maintain the cardio stability and the neurostability of the child in order to resect as much of the tumor as we could, because the tumor was not suitable for chemo or radiation. And through a brilliant multidisciplinary team with the hands of a skilled surgeon and with meticulous care to the anesthetic from my part, we achieved great success for that child. And so posterior fossa tumors can be scary, they can be difficult, they can be long procedures, but they can be incredibly, incredibly rewarding.